My name is Dr. Nino Kuzmar, and I'm the Medical Director of St. Clair Cosmetic Clinic. Here at St. Clair Cosmetic, we specialize in non-surgical cosmetic rejuvenation and enhancement procedures for the face and neck. Today we're going to do a lip augmentation on our beautiful Sherry. And Sherry's already had about 2 syringes done over the last year. We started off with Volbella, which was just kind of a little bit of a taste of a lip augmentation with her. It really didn't give sufficient volume, but it did lift a little bit, and she kind of liked she got a taste of it, and she really kind of liked the idea of a lip augmentation. And then a few months after that, we did 1cc of Volift, and that was probably, what, about 6 to 8 months ago, something like that. And we brought out, and you can still see the product is there, nice contour to her upper lip, a little bit of eversion, and her lower lip is everted as well. So what we're going to do now, because I think we could use a little bit more volume and a little bit more lift, especially in the upper lip. So essentially we're going to go with another syringe of Volift. Now the approach to Volift is to take the product from the standard syringe size with its 30 gauge needle, or actually I think it's a 28 gauge needle, I'm not sure exactly, but either way, and to transfer into a 31 gauge Botox syringe, which is a much smaller needle, and then use what's called a microbolus technique, small aliquots of product, specific amounts into precise areas. It allows for much more precision in the lip augmentation, and there's very little risk of overinjection in any one particular spot with this technique. And I've been using this for the last probably 10 years. So that's what we're going to do today. As you can see, Sherry's extremely excited, which is always positive. So what we're going to do first, and we prepped her with topical lidocaine, ice, etc., etc. And so what we're going to do first is essentially go right into the peaks, and a little pinch, and put about a couple units into there just to lift up the peaks a little bit. Pinch, pinch. Very good. And we just do that as a starter. And what I'm going to do now is go into the lateral aspect, just below the vermilion border, a little aliquot in there, just a little there, and right into the peak now. These are just initial injections, getting a little bit of freeze into the lip. Sherry will feel much better. You can see the lip is already coming up a little bit. Volift is a fabulous product. While allowing that to freeze up a little, chin down a little bit for me. Perfect. So what I'm going to do is I'm going to do a little bit more of an eversion into the lower lip. So a little pinch. And my little tripod to this area. Squeeze. And you can close your mouth. See the lower lip come out a little bit. And go slightly lateral to that. Beautiful. And just relax. Another one pinch. Very small amounts. Close your mouth for a sec. But very evenly distributed. You can already see the lower lip coming out. And I go further lateral. Pinch. Pinch. And walk in the park. Beautiful. It's always nice to have beautiful lips to begin with. Easier to inject. Relax for a sec. But having said that, this is her 3rd syringe in 1 year. Her lips were not this voluminous before. We're of course staying very conservative still, staying within the confines of her face and not creating lips that don't belong on his face. Beautiful. Okay, so we did a little bit in the upper, we did a little bit in the lower. Now the lower is going to be nice and numb. while I go back to the upper lip, and I've already finished my first third of the syringe. And now I'm going to the second third of the syringe. And what we're going to do here is I take a look and I see, okay, I think I want, close your mouth, open your mouth a little bit, just a little bit, and close, and open again. Okay, so I can still feel some product from before. You have to be aware of where the placement of the product is, so that you're not doubling up on some of these areas too much. You are going to be doubling up, but you just don't want to be doubling up too much. So I think what I'm going to do with her, rather than going on the inside of the mouth, is I'm going to continue to do these micro boluses perpendicular and just introduce the product this way. Small amounts, about a couple units per injection point, and this will right along the vermilion border. Now, there's obviously a lot of needling going on with this technique. Sometimes you get a little bit of swelling, but it's otherwise a very, very nice way to inject product, because you won't be injecting too much in any one particular place. Because you have the product in there, I just didn't want to go straight on top of the product and line on the inside of the mouth, so I approached it from a different way. See the lip slowly making its way. Small aliquots. Okay. So now I've given a little bit of lift. Now I am going to go on the inside now. I'm going to go on the other side. My way over, because I want to lift this upper lip now. Open your mouth a little bit, perfect. So what I do is just right into the meat of the lip. Dab into the meat of the lip. Open your mouth a little bit, and right into the meat of the lip. But small amounts. Up into the peak and out. And we're nearing the last. Open your mouth for a sec. You can see the lip is already coming out nicely. Some inflammation, that's normal. There's a lip augmentation open up. Okay. One more time. Close. So you can already see these lips looking nice already. Now what I see is I see an inverted upper lip with good peaks. I wouldn't want to do more up there. What I would do now is I would go into the lateral lip aspect, just pop a little bit out here, just to evert. We have the nice version of here, but I think we can do a little bit more just on the outside there. And the beautiful thing about this technique, it allows for that. So, they just do it just exactly as you are. And a little pinch, and just essentially fan that product out at one point, close. So you can see how that has come out already. A little bit of millimeter or so, chin to the side. You can see a nice contour. Very nice. Very natural. Head back. She's my receptionist and office manager, so I don't want her lips out to here. I want her lips nice and beautiful and looking like they were hers all along. Okay, relax for a second. Yeah, just a wee bit more. Oh, it's nicely. It looks very natural. You look. There's obviously more lip.